They don't know how to ask of, doctor, can you do an occlusion exam for me? They don't know how to ask that question.
The very first question comes from Australia. Gary, I'm getting mixed messages about the best format for the first appointment for new patients. Is it better to bring the new patient in for a records and doctor exam first appointment, or bring them in for a hygiene appointment first?
That's such a great question, Naren. And thank you for our listener for submitting that one. And I think this is one that's on the mind of many, many, many dentists. And I'm going to answer it this way. If the world was perfect, I would bring the patient in for a records and doctor exam first. That'd be a standalone. So in other words, we get the records that we need. It could be bite wings. It could be full mouth series. It could be a digital panoramic x-ray. It could be a CBCT series. And then the doctor part of the exam. Then you can determine exactly what the patient needs. You think of that as kind of a screening appointment. It'd be an hour-ish, and it would not have a hygiene component attached to it. That's the way the institutes teach it. That's the way Pankey, Dawson, Spear, Coyce, LVI, and any of the other institutes teach it. However, I'll put a practical spin on it. I say if the world was perfect, I would do it that way. However, it simply leaves off one really important component. What does the patient want?
Right.
What does the patient want? And so we've learned in my own practice and working with clients all over, what most new patients want is their teeth cleaned. Now, it may be all they know how to ask. They don't know how to ask of, doctor, can you do an occlusion exam for me? They don't know how to ask that question.
Right.
So what we've learned is that there's a way to combine the two of them together into one appointment. And it's a combination records, doctor screening exam, and hygiene appointment. And in the hygiene appointment, we're either going to do a cleaning or debridement, And so it's a combination appointment that is 2 hours in length. The patient's there for 2 hours. It's 30 minutes of doctor time. The 30 minutes of the doctor time is kind of a screening exam, screening appointment. Now, if it's simple dentistry, then we present the dentistry right there and get them set up with a treatment plan. If clearly they're interested in way more, that can be done, then we bring them back or we do a virtual consult. We're using your service, what you designed, Naren, in Equa as a virtual consult. And, my clients are using it, and my clients are telling me that they really enjoy the opportunity to do these virtually in the right situation. You already have all the records you need. The patient can be in the comfort of their home. You can spend whatever time is needed and go through it in a Zoom meeting type video,
Right.
and really spend time, or you can bring them back and do it as a separate live, a process as well. But I would do it in a combined appointment because of the fact that you're giving the patient what they want. And what they want is a hygiene appointment. And you're doing it, of course, we're examining them first so that we know whether that's a cleaning or debridement. And so we're meeting the Practice Act requirement of having seen the doctor first and so on. So that's how I would do that. Hey, thanks so much for watching this video. And if you found it helpful, leave a like, subscribe, and click the bell button so you'll be notified of any time we upload future videos. I think you'll enjoy our coming content. Thanks so much.